Rachel, thanks so much. All right, on to our Health Watch now, where we discuss all the topics that are trending in the medical world. As always, we're joined by Dr. Syed Hussain of Trinity Health here from New England talking about this. So first one, we're coming out of flu season, so we're taking a look at the data, and what we're hearing from the CDC is that 216 children died from the flu this season. Where does that land as far as high or low than other years, or is it on average?
So this is a much higher than average that what we've seen in the past several years, Erica. It's actually very concerning. It's the highest number of children that have died from the flu since the 2009-2010 swine flu pandemic, global flu pandemic. So these are high numbers. And behind these numbers, once we start peeling the onion, we'll see that it also correlates with lower vaccination rates.
Okay.
Over the past 5 years alone, vaccination rates in children have gone down from 64% to now 49%. And even though across the country flu rates are going down, we're still not out of the woods yet. So usually the CDC looks at total numbers, looks at all data in the fall. So I believe this number, the 216 number, will go up as more data is collected and gathered by the CDC.
So you think it's going to go even higher?
Yes, yes. Now we know it was a very severe flu season, but it did have a particularly grave impact on children.
And that is primarily just because people were not getting the flu vaccination.
That's right.
All right, so moving ahead, we want to really ramp up those numbers.
Absolutely. Bottom line, especially now in this age of so much misinformation and vaccine resistance, it's important to look at the data, look at the science, talk to your healthcare provider, talk to your children's pediatrician, because we know vaccination will prevent severe illness. It may not necessarily prevent getting the flu, but it will prevent hospitalization and complications from the flu.
Right. All right. Good things to keep in mind as we move forward. Also, we're talking about nationwide investigation into salmonella and outbreak, particularly with backyard poultry. So what do people need to know? I mean, we've talked about this before.
We have, and there's nothing to be overtly concerned. It's not New England that is impacted. There are other states. There are about 6 states.
But we're going into barbecue season.
That's right. That's right. It always helps
out
to
the grill. Yeah.
Wash your hands. You know, we're going to be talking about hand washing too and national numbers, but that's important. Now, what are symptoms that you should look out for when you're dealing with salmonella or there's a suspected salmonella outbreak? Is diarrhea, fever, stomach cramps. Those are cardinal symptoms. And usually in most people, either they might be asymptomatic or they'll resolve on their own. If they're not resolving, then that's when you reach out to your healthcare provider. Or if you're an infant, if you're immunocompromised, if you're above the age of 65, if you fall into a high-risk category for developing complications from salmonella infection, then there are other modalities. Dehydration is a big complication. There could be others like bacteremia in the blood. So reach out to your healthcare provider, seek medical attention if if there's any suspicion.
And just take those precautions so that you don't get it in the first place.
That's right, exactly.
Yeah.
So where do you get salmonella from? Undercooked poultry, for instance, or fresh basil, eggs, unpasteurized milk.
Fresh basil, I've not heard that one.
Yeah.
Okay, so that's a reminder to wash your herbs really well.
Exactly, your fruit and vegetables, and make sure that your meat is cooked. And it's not raw, for instance.
All right, getting back to that hand washing story you sort of mentioned just a minute ago. A new report is revealing how many people forget or just choose not to wash their hands after going to the bathroom.
Yeah, this is one of those basics that we hammered during the pandemic, and it really does apply now as well.
Not just during the pandemic, it's kind of just like
That's right. That's right. It's been a tenet of preventing infectious diseases. So 80% of infectious diseases can be prevented by just washing your hands. And by washing your hands, I mean soap and water for 20 seconds minimum.
Right. I mean, we teach our kids, wash your hands for as long as you can do the alphabet.
That's right. So in this survey that just came out, half of U.S. adults admitted to not washing their hands. 1 in 5 actually said, even though they remembered, they chose not to because they were worried about, drying their hands, or they just didn't have time, they were in a rush. But those 20 to 30 seconds can prevent an infection from happening. Yeah. So it does make a difference.
Just get that soap and water on your hands, right?
Right, absolutely.
Don't worry about the dryer. That's kind of secondary.
Right. And it's not only just flu season. To your point earlier, it's around throughout the year, because there are other bugs that you can get.
Absolutely. All right. Dr. Hussain, as always, thanks so much.
Thank you.